Hello, I'm a mask. I'm here to look at what we now know about COVID, how this disease spreads, and how you can best protect yourself and others from getting seriously ill. COVID is an infectious respiratory disease caused by a coronavirus that gets its name from its crown-like appearance. As a respiratory disease, COVID can affect all the organs involved in breathing, as well as your heart. Many people infected with COVID get mildly ill and recover without requiring treatment. Others become seriously ill, require a hospital stay, or die. COVID is spread when virus particles are released into the air. When an infected person breathes, talks, coughs, or sneezes, the virus catches a ride in the droplets of saliva and moisture expelled through their nose and mouth. The larger, heavier droplets fall to a surface. If you touch that surface and then touch your face without washing or sanitizing your hands, you run the risk of getting infected. The smaller droplets can float in the air for hours. If you are in a crowded indoor space or in a room with poor ventilation, these infected droplets can hang around in the air for a long time, and you risk getting infected as you breathe. This is why hand hygiene, mask wearing, good ventilation, and physical distancing are essential to reducing the spread of COVID. Your body's immune system fights disease by keeping a record of every germ it encounters. Because COVID is a new disease, your immune system has not yet learned to recognize this virus. To make things more complicated, this virus changes very quickly, is highly contagious, and not everyone has the same symptoms. In fact, some people have no symptoms at all but are still contagious. There is nothing simple about COVID, but we do now have effective tools that can help you protect your health, the health of others, and also control the spread of the virus. If you have COVID symptoms, such as a fever, cough, headache, or congestion, get tested as soon as possible to see if you're positive for COVID. Check to see if your employer provides self-testing kits for you. If they do, follow the directions carefully. If they do not, go to your local walk-in clinic for testing. If you test positive for COVID, inform those you have been in contact with. Recommend that they also get tested and quarantine. Up-to-date recommendations can be found on the Centers for Disease Control website. Stay at home for the recommended time and physically distance from others in your household if you can. If you must share space, wear a mask and have others wear masks. Don't share things such as towels and utensils without washing them, and don't have visitors. Make sure you get plenty of rest, eat nutritious meals, and try not to do anything strenuous until you are completely recovered. If you are feeling sick, contact a trusted healthcare provider to find out what treatment options are available for you. If you are having difficulty breathing, go to an emergency room. It is a safe place for anyone. Regardless of your ability to pay, you will get the medical care you need and access to a social worker who is there to help you. Remember, it is your right to get the care you need in the language you need. The COVID vaccine helps your immune system recognize the virus. A vaccine will not stop you from getting the virus. It will not cure this disease, but it will help prevent you from getting severely ill, being hospitalized, or dying. Vaccines are safe. Be sure to ask your doctor which vaccine is best for you and how often you should get boosted. Boosters save lives by giving your immune system the additional information it needs to fight this rapidly changing virus. There are many different types of masks. High-quality masks, such as N95s, are preferable, but it is important that your mask is comfortable and fits your face snugly. A mask may be inconvenient, but it does help reduce the spread of this disease. Ventilation brings outside air into indoor spaces, so turn on an exhaust fan, open doors and windows. This reduces the concentration of infectious droplets and removes them faster than would happen in a space that is poorly ventilated. Cough into your elbow so you spread fewer droplets directly into the air. Clean surfaces after using them. Wash your hands frequently and thoroughly with warm soapy water. If clean water is not available, use hand sanitizer. COVID spreads more easily when people are close together. So, if possible, try and avoid crowded places, especially when those places are indoors. Understanding what COVID is, how it spreads, and how to prevent infection gives everyone the ability to assess the risks they are willing to take to protect themselves, their family, and everyone in their community. Thank you for helping control the spread of this disease.